About 60 years ago, this whole field of biosensors commenced. And it came from an invention where we showed if we put a piece of biology on an electrode, we could monitor glucose in the blood without any separation steps involved. And what it did was take the enzyme that the body uses to selectively bind to glucose and connect that with an electrode. What it meant was that it allowed us to no longer have to send a sample to the lab to do the analysis of the blood, but a person who has diabetes could actually monitor their blood glucose at home. And that really revolutionized the care of people with diabetes. And almost as soon as that concept was shown and people actively investigated and explored that general concept, people almost instantly wanted to know, well, can we monitor molecules continuously? Because that would really make things even more powerful in how we monitor health. In the case of glucose, we actually achieved that about 20 years ago now with the continuous glucose monitors. But for other molecules, they've never had the technology. And so for a long time, people tried and tried to develop technologies to do that. But really the problem was always the continuous, being able to monitor something, let it unbind and keep monitoring it. And that really, most people pretty much gave up on that vision. Around 2010, then Kevin Plaxco came up with this new idea of the EAB sensor, or Electrochemical Aptamer-Based sensor, where he used a piece of DNA that selectively bound to a molecule. But what was really interesting about this, it could also let them go again. And that created the potential for continuous monitoring. I thought it was interesting at the time, but it was only in 2016 when I saw Kevin speak at a conference in Gothenburg, where he first revealed to the world that he could actually do this continuous monitoring in a living animal. And for me, that was absolutely game-changing. It was going to completely transform the field of biosensors, because now we had a technology that could be applied to many different molecules, because aptamers can be applied to almost any molecule you can think of, from a drug to a hormone to a protein. So suddenly, the field of biosensors was busted open again, and we had a whole new direction to look into. And this is an important direction because it relates to what we all want in healthcare. And not just healthcare, but our own health. Many of us have smartwatches now, and we're all really interested in this concept of keeping ourselves healthy by monitoring things. But we monitor things like blood pressure, the number of steps we do, our sleep cycle, but often we really want to monitor, and especially for healthcare, we really want to monitor certain molecules. We've never previously had the technology to do that, but this aptamer approach using the EAB sensors could then become a wearable device, much like our smartwatch, that gave us real chemical information. And this would absolutely transform how we did our personalised health and personalised healthcare. It really is a complete and utter game changer.